Vanakkam, Namaste and welcome to Dr. Shahs Clinic. In this video, I'm going to answer a question that I get from my patients, and the question is how to improve sperm quality for IVF or how to increase sperm quality with respect to IVF. So, if you have been suggested an IVF or an ICSI treatment based cycle, it means maybe your sperm count is very low. That means your sperm count is usually occasional motile sperm cells seen, or a sperm count that's usually less than about 5 million, or anywhere between 1 million to about 5 million cells per ml of semen. And of course there are various indications for IVF which I'm not going to go into right away, but if your fertility specialist has advised you to go for an IVF cycle, remember you have to produce the quality of your spermatozoa becomes exceedingly important, because what happens is during an IVF or an ICSI cycle, the clinical embryologist will basically select the best appearing or the most morphologically normal appearing spermatozoa under the microscope, nick the tail and inject it into the egg. And the selection criteria is based on cells that are motile as well as morphologically normal appearing cells. So you need to optimize your sperm quality before you leap into an IVF cycle. And I would strongly recommend that if you're taking a decision for an IVF cycle, if your fertility specialist tells you to take an IVF cycle the next month or the same particular month, I would ask you to wait for about 8 weeks before jumping in. Why? Because you can use the 8 weeks to optimize your sperm parameters before going in for IVF. Because what happens is, if you improve your sperm quality before the IVF cycle, you're going to see better fertilization rate, better embryo development rates, including better pregnancy rates. So the sperm is just as important as the egg with respect to an IVF treatment cycle. And remember one thing, the success rate of any IVF treatment cycle does not go beyond 32%, and you want all of that 32% on your side, right? So you don't want to spend 2 to 3 lakh rupee and end up with a wasted cycle. So here are some tips to improve your sperm quality for an IVF cycle. First, ensure for the 8 weeks before your IVF treatment cycle, ensure to walk at least 6 to 7 kilometers every day, 10,000 steps, 5 days or 6 days in a week at bare minimum. That's because testosterone increases when you do this. Increased testosterone improves your sperm quality. Tip number 2, ensure you have at least 6 to 7 hours of restful sleep. That's very important, because with proper sleep, your testosterone secretion, your hormonal axis is all in balance. That improves your sperm quality. Point number 3, take folic acid 3 times a day, 10 milligram, one in the morning, afternoon, night, because folic acid has been found in numerous studies to improve the DNA integrity. I have also had personal experience with the medication. It's very good because it improves. Plain folic acid costs about 1 or 2 rupees or 3 rupees at best. Just take it, and it's a natural it's a good antioxidant, and it helps a lot in terms of improving sperm quality. That's tip number 3. Tip number 4. So tip number 5 would be you take apple, carrot, beetroot juice, because it contains a lot of flavonoids, and take all types of colored vegetables and fruits, and that also helps improve the sperm quality. Tip number 6 would be remember to avoid sugar sweetened beverages, avoid junk food, avoid deep fried and oily items, and take food that is rich in fats and proteins, and try to go towards a plant-based diet, because what basically happens is your overall glycemic index in your bloodstream is going to be very low. There's less oxidative stress on your body, and there's less membrane damage that's occurring to the spermatozoa at any point in time. So that's another tip to improve your sperm quality during life cycle. Now the last 2 tips are very important. I want you to pay careful attention. Now if you're obese, and what happens is, for individuals who are basically obese, what we tell them is to do is try to target and lose 10% of their body weight, because a 10% loss in weight is more or less equivalent to a 10% gain in fertility, right? So there are studies for that. And although obesity doesn't drastically affect semen parameters quantitatively speaking, but from a qualitative perspective, when you're obese, your testosterone becomes converted to estrogen, and because testosterone is an important hormone for sperm production, you don't have enough testosterone in your bloodstream. That's the hypothesis, and as a result, the quality of sperm production goes down. So for some patients, where we calculate something called as the testosterone to estrogen ratio, and if that value, we try to bring that value less than 10, because what happens is we give a medication called letrozole, which is basically an aromatase inhibitor. And what letrozole basically does is prevents the conversion of testosterone to estrogen. It allows more testosterone to be available in the bloodstream, and thus the sperm quality also eventually goes up. So that's something that you should consider if you're morbidly obese, or BMI is very high, like say more than 30 or so. For all other practical purposes, if you're slightly overweight, it really doesn't matter. If slightly overweight, doesn't matter. Just keep walking, keep exercising, eat healthy, sleep well. avoid sugar sweetened beverages, and you'll do just fine. Now, the last point to bear in mind is that abstinence, ejaculatory abstinence, is a very, very important point. Remember one thing, when you're giving a semen sample for the IVF cycle, go with a very short abstinence. So, say if you have sexual intercourse the previous day, go the next day and give your semen sample. And what we have seen is with ultra short ejaculatory abstinence periods, what basically happens is your sperm quality definitely goes up. And even though the quantity may be low, for IVF you don't need those many sperms. IVF ICSI cycles, all you need is about 8 to 10 sperms. You'll be producing in millions, so do not worry. So I hope you enjoyed this video on how to improve sperm quality for IVF. I hope you implement all these steps. Put in your comments below. Please like, share and subscribe, and feel free to reach out to me in case of doubts and clarification. This is Dr. Shah. I'll see you soon with another video. Vanakkam.